Hello, everyone. Thank you for joining us here today and welcome to the Premi Power Week. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Premi Power Week is the second of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. These education sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Associations of Neonatal Nurses, EFCNI, and GLANS, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Premi Power Week. And right now I have here Dr. Nicole van Veenendaal from the Netherlands. She's going to talk about the Crown Initiative, creating room and opportunities on wards for newborn and their families. Dr. Nicole van Veenendaal will be presenting an European initiative on family integrated care with leading hospitals in the field of family integrated care, the Crown Initiative, creating room and opportunities on wards for newborns and their families. She'll be presenting introducing the 4 C's for closeness, core components of FICare within neonatal settings. This can give an overview towards successful implementation of FICare independent of setting and resources. Dr. van Veenendaal works as a clinician scientist, PhD student, and epidemiologist in the Department of Neonatology in OLVG. I'm sorry if I mispronounced that.
It's good.
A large teaching hospital in Amsterdam, the Netherlands. Her interests are within human development and neonatal care. She studies the impact of family integrated care on preterm infants and their parents, and has set up several studies and trials into this field of research. She works together with all stakeholders in neonatal care, including veteran parents, as a multidisciplinary healthcare professional team who are active contributors to her research. In the Department of Neonatology, she set up a family integrated care program for parents, nurses, and physicians. Dr. van Veenendaal, thank you so much for joining us here today. I know you are many hours ahead of us. It's the end of the day for you, so we are so grateful to have you sharing your knowledge, your experience, and expertise on family integrated care today. Thank you. I will let you share your screen, and at the end of the presentation, we can have a Q&A time.
Sure. So thank you so much, Fabiana, for these very kind words and inviting me to this great webinar. Indeed, it's almost 7 o'clock here in the Netherlands, and I'm very happy to present to you some of the findings of our Crown Initiative, which we set up together with parents and together with the EFCNI. So to start off, I'm in the Netherlands, so this is Europe. You probably know the Netherlands from their windmills, the beautiful tulips. It's too bad you can't visit now due to the COVID. So it's this small country. And I work in Amsterdam, which is famous for their canals. We have beautiful ice skating in the winter. And I work in the large city hospital, which looked like this approximately 100 years ago, the nurses and all the mothers and babies together. And as you might know, I am an epidemiologist trained, and I really love numbers. And I work at OLVG, very good Fabiana, which is actually the Dutch saying for Our Lady Peace. Our Lady Peace Hospital. And we work there with family integrated care in single family rooms, but above we have a full integration of maternal and neonatal services. So here you can see one of the rooms, which is a neonatal room, in which we can take care of the baby and parents can stay. But we don't only have neonatal rooms, we actually have dyad rooms, so for mother and infant care. We can provide antenatal care, labor, postnatal care, and neonatal care at all times for mothers and babies together. We have approximately 53 rooms, and this is the floor plan. And one of the rooms in which we can take care of mother and baby looks like this. So here you have a mother who has just given birth, and next to it we have a baby, and father can be there as well. As long as mom needs medical care, she can stay with her baby, and the whole family stays together. Once mother gets better, they can move to smaller rooms as we don't need as much space for mothers. Here you see another floor plan with a room, and here's a lovely couple, a mom and a dad with their 26-weeker, who stayed in our facility for a long, long time, and they were eventually discharged home with tube feeding. And Noah now is 2 years of age and is doing really great. So we don't only have the architecture. I think that's not one of the main things that you should focus on when talking about family integrated care. As Carol told us, it's about parental presence. It's about having parent partnership. So here's one of a twin, also born at 26 weeks, with the mom and older sibling who can stay together. We do rounds with parents at all times. Nurses also attend. Parents support each other. They can meet with each other. We have educational sessions for parents and for staff. And we have 2 dedicated nurses that actually lead our FICare program. So with this in the background, we were thinking about how are other hospitals actually delivering their maternal and newborn care. But most of all, we were interested in what do parents actually find is important when we talk about FICare. So to answer this question, we teamed up with parents from our Dutch association, and we looked at the EUCNI standards, and we asked them, what do you think is most important? So 48 parents answered to us, 46 mothers mainly, and 97% is very keen and thinks the most important issue to explore is if they get separated from their infant. Other important issues they think is, are they able to room in? What can they do in care? Can they participate in medical rounds? And if they can perform kangaroo care. So parents actually put closeness at the center. However, the Netherlands is very small. We did a small pilot study going around our hospitals, but we were actually interested in the greater picture. So we used 19 parent-rated questions for interviews, which were semi-structured, and we asked leading centers in family-centered and integrated care in Europe on how they give their maternal and newborn services. We used the 4 pillars of FICare, and above all, we did the qualitative analysis with parents together. So I teamed up with the mother of a 26-weeker who's actually also a scientist, and together we performed our qualitative analysis. So it started off with a snowball, and it became an avalanche. We interviewed 44 units in Europe and 1 unit in Canada. And as you can see, we have the Nordic countries, we have the southern countries, we even have low to middle income countries such as the Ukraine participating. And first I'll talk to you about the more numerical results. So we asked them if they had to separate mothers and infants during maternal and or newborn care. And what we found was that it is very, very common. Almost all units have to separate mother and infant during care, even in those units that are leading units in FICare or family-centered care. Approximately 1/3 can implement family-centered rounds, which Carol already elaborated on. Approximately 1/3 had education sessions for parents, and just a little than half had education sessions for professionals in which they were educated on the importance of parental presence. So these were just the numerical data, but we were especially interested in factors for success. How do you actually achieve closeness in your unit? What are the burdens that you encounter? How can you make this a success within your unit? We did the analysis and we came up with these 4 factors. We have culture, collaboration, capacities, and coaching. And at the center there again is closeness. And I'll walk you through all the different factors for success. Let's start off with closeness and the culture around closeness. So culture is the jointly held characteristics, values, thinking, and behaviors of people in workplaces and organizations. As you have experienced your NICU or as a healthcare professional, you probably have a feeling of the culture of your unit. And so did our interviewees. They had some culture that was very natural. So one of the quotes was, "It's within the culture of the unit. The nurses are usually really upset if the parents are not there. They come to the doctor and complain. There are alarm clocks ringing if the parents are not there." But other units were very reluctant. They said, "I think staff don't want parents around because parents look on their hands." So if we go further from culture, we look at collaboration. And as you know, collaboration is the act of working together. It's either between staff and parents. And we had very interesting quotes. And this one is one that I really, really love. It's from a unit that told us that on the collaboration between staff and parents, it's kind of promoted that everybody has their own important role to play. Parents carry that 6th sense. But also, the act of working together or collaboration for closeness was very important on the staff level. And by that, I mean the staff level between different units. So it could be, as this one said, that they work together very good. So sometimes we have an agreement with the maternity ward that they come and supervise us and take care of the mother, and they can stay with their child. So actually, by working together between the different units, mother and her infant could be together and they did not have to be separated. And another one, especially important, is to regard family-centered rounds. So how is that working on those units? What are the thoughts and the themes that come up? So one of the units told us, "I think family-centered rounds are very wise. The parents could give us a lot of information about the infant." Again, kind of approaching that 6th sense. And other units had problems. So the parents cannot be in the unit because of confidentiality questions. So this can be an important issue, but also some of the units had solutions such as signing confidentiality agreements, putting on headphones for parents, trying to make it work. Then one of the important themes is capacities. So capacities are resources of supply or support, and they can either be physical, like equipment that's present in one ward or is not present on the other ward. It could be human, such as staffing, but they could also be around policies such as guidelines and logistics. So let's start off with physical. One of the main burdens around mother-infant closeness or parent-infant separation, whatever you want to name it, is this. Our maternity ward is in another building, obviously separating mothers and infants. But other units had different issues. So the other most common issue was space. The big difficulty for us is space. You know, we've got several babies in a room with lots of equipment, and it's very, very difficult. Other capacities were human capacities, such as staffing. And one of those interesting quotes was the following: "We don't like to give an intravenous catheter on the maternity ward, as it is a very busy ward. And if these nurses need to take care of these babies, then they don't take care of other babies. They do not have time to do everything." I think also nowadays that's a very relating quote that we could all relate to as healthcare professionals. So policies for parent-infant closeness included examples such as early discharge home programs for infants being discharged with tube feeding, and of course open access policies allowing parents to be there at all times, not considering them a visitor. And other capacities would be like free meals and free parking for parents so they could be able to be there. So the factors for success, the last one is coaching. And also Carol already touched upon this theme. So coaching is acquiring and transferring knowledge and skill. One of the centers, which were actually leading centers, talked about how they tried to coach their staff and how they tried to get them comfortable taking care of the other part of the diet, which is one of these quotes. So we've had this educational rotation. Our NICU nurses went to the prenatal and postnatal ward, and midwives were in our unit for periods. So this is part of coaching, but of course it's also part of collaborating and having an open culture, being open to other views and being able to work together. And the other one is, of course, about education to staff. So you need to provide education for staff because they support the families involved. That's a big part of what happens. When a new nurse starts in our unit, they are orientated in integrated care and coached by a parent. So this was the only unit that actually had reversed coaching by parents to staff. Some units, as I showed, approximately 1/3 had coaching from staff to parents. So whenever we look at these outcomes and whenever we look at closeness as a core component of family integrated care, we found 4 themes: the culture, and within that culture, the collaboration, coaching, and capacities. And again, this is not to replace the 4 pillars of FICare, and definitely not. This is about the facilitators and barriers and the factors for success to keep families close in the unit. And again, that really touches what Carol was talking about parental presence being, we cannot change that with anything else but the parent. So in conclusion, mother-infant separation during periods of neonatal or maternal care is very, very common. And if we can focus on those 4 C's of closeness, we can actually have better FICare practices in our units. Let me see. Fabiana, I think I'm ready.
Thank you, Dr. Van Veenendaal. What a great presentation. Thank you so much for sharing with us and for really shine a light on what is happening in your unit. I'm hoping many others can follow. So congratulations for this great initiative. So my first question is, what happened with this model during the pandemic?
Yeah, that's a great question. So please keep in mind that we are Dutch and very stubborn. And within our unit, we actually challenged our hospital management, who were actually keen on restricting parental presence, as we have had very much experience now with the irreplaceable role parents have during hospital stay of their infant. We just said no. Parents should be here. They are key to infant development. We're not going to restrict parental presence in our unit. But we were very fortunate that we have, of course, single family rooms for everybody. So that's, of course, one of the issues that others might have, which made it easier for us. And of course, within our FICare program, we did have some difficulties because we could not have the educational sessions together with the parents together in rooms. So we're still looking for digital alternatives. And we had to close off the common areas where parents could be together, again, because of the social distancing regulations.
So how about siblings? Or siblings is still unable to come inside the units, or they were not allowed to come?
Yes, they were allowed to come, but again, they had to adhere to physical distancing as well.
So parents, do they get screened every day when they come to the hospital? How is those protocols?
No, they're not screened, but whenever they have symptoms, they should be screened per local policy of our city, and then we ask them to self-quarantine. Yeah.
So I have a question coming here in regards of the statistics we presented. Was there a mix and match as to what sites were doing what, or were there certain sites that were doing all?
Oh, so considering the sites that I was interviewing?
Yeah.
So it was very mixed. I did not look at it from that perspective because you were really looking at facilitators and barriers for keeping mothers and infants together. If you would have to make a matrix of all the different interventions that were implemented, just as Carol told, you have parent-delivered interventions, you have parent-partnered models of care, you would get an exuberant and large matrix, not telling us a lot of more information. So, no.
So for hospitals that don't have single rooms, what are your recommendations from your perspective? How can they still keep families together during this time using this model of care?
Yeah, so as also Carol pointed out, I think it's all about partnership. I think it's about having no hierarchy between staff and parents and staff, how do you say that correctly? Acknowledging parents in their irreplaceable role and that they are actually healing to the infants. They actually have a healing and very important role to play in the treatment of the babies we are caring for in the NICU. But of course, I think, as Carol also told everybody, you have to adhere to local infection control measures. So using face masks is, of course, very, very important. Keeping physical distances is very important. I'm not saying you should not do that, but I think you should have an open dialogue between the staff and parents and try to shift the culture towards where it's normal for parents to be there.
Absolutely. So you were one of the key players on the position statement to come up with the position statement with all those incredible points that Carol or Brian just shared with us. How do you feel as a healthcare professional and a fierce advocate for parents to hear what is happening around the world? And we know that a lot of hospitals in Europe have visiting times in the beginning of the pandemic, and there was a lot of advocacy to change a little bit how things are right now. It's still in Canada, we have 2 parents, but no siblings. In some hospitals, it's 1 parent at a time, not together. So how do you feel about that?
I think it's heartbreaking. actually. If I think of how far we've come together, and now we are going back 50 years, I think it's heartbreaking. That's my first feeling about it, but I think we should move forward and again look at the possibilities that are there. And I think that the COVID pandemic is actually showing us how important it is to be compassionate, for families to be together, not only in neonatal care. I mean, you see all these heartbreaking television fragments of elderly people not being able to be with their families. I mean, why should that be different from babies? I mean, they should also be together with their families. So yes, that's my personal opinion.
So how do you see the healthcare system moving forward with families integrating the care of the babies in the NICU after the pandemic?
That's a good question. So I hope that we actually learn from what's happening now, and that we can open up dialogue between parents and professionals, that we can see how important they are, the parents, and how we really need them in the NICU. I mean, it's not that they're there and that they're a burden. No, they are there because they have their infant there, it's their family, they need to take care of it. I mean, it's more than normal that they should be there. And they're not a burden. And I hope people see that and that we can move forward from there.
Absolutely. Dr. van Veenendaal, any final thoughts before we close your session today?
Any final thoughts? I hope that people see the importance of parent partnership in neonatal care and that we can move forward together. I think that's one of the most important issues to explore and to maintain.
Absolutely. We have a comment here from Monica Virgis. She runs a parent organization in Madrid, Spain. It's an excellent situation in the Netherlands. Dr. Nicole, thank you. So absolutely, I think this is from all of us, parent organizations from all over the world, to congratulate you on this initiative and your advocacy to keep parents together with their babies during the pandemic and beyond. And I hope that we can really work together in more collaborations to keep this going and see this in many more units around the world. So thank you so much for today. I appreciate all the work that you're doing.
Thank you.